at this point in Good morning, everyone. This is Brian Eller with the Pima County Health Department COVID-19 Schools Liaison Team. We've got a couple of the other folks from the county on the call here today. We're going to briefly go over the agenda before we get rolling into everything. The first thing is that there's going to be a format change to these meetings, just primarily in the interest of maintaining the sanctity of everyone else's time. So we'll be doing all of our brief updates at the front end of the agenda, what I think is probably the stuff that you all most want to hear. And then we'll get into any PowerPoints or any other presentation material towards the end of the agenda. So that way, if folks need to jump off for whatever reason, they can do so without having to stay through the entire thing to just gather the 15 to 20 minutes of information they may be looking for the most. Obviously, as we're heading into a period of increased transmission, I think that a lot of the numbers and the brief updates are what folks on this call are most interested in. However, if that's contrary to the point, or if there is other information that's presented by you all saying, no, actually we get a lot out of the PowerPoint material or the presentations, then we can switch that around. But this is just based off of some of the interactions and conversations I've had offline with some of you on this call and folks from the Thursday call as a whole. So coming up, again, we're gonna reorganize the agenda, the brief updates. I talked about that briefly. And then we'll also be doing, on an upcoming session here, some holiday guidance messaging. So what are the things to remember during the holiday season? You've probably heard a lot of press about this. We're going to be pretty consistent on our quarantine isolation guidance as of yet, but we'll have some space at the end of the agenda today to discuss some of that. So on the updates section, we're going to jump into some of the local legislation first. Let me just pull up my screen here. And here we are. Okay, is everyone seeing this? All right. Thanks, Dexter. I rely on your thumbs often. Okay, so the first thing to cover is the emergency measure 2020-04, which you'll see me open here in a minute as I go over to. So we talked briefly about this in a previous session, but essentially what we're looking at here is the declarations at the latter part of this document is that each school district and charter school shall immediately mandate that masks are worn on school campus, on school buses, during school-associated activities, and while participating in or observing any school-associated athletic activities by all students, faculty, staff, contractors, and visitors. So there's not a lot of change in terms of what Pima County's been asking for with masks. This, I think, just implements it at a larger statewide level and allows us to leverage our ability to implement the business complaint area, which essentially could potentially put a facility, specifically private schools, since the county attorney has made a declaration that private schools, or not the declaration, but the assessment that private schools essentially fall under what would constitute a business, that we could potentially leverage a fine for the public nuisance if masks if there's a documentation of masks not being worn as met by this specific guidance put out by this legislation through this emergency measure. So if anything, it's just more ammunition for any of you all to make sure that students, when they're attending your school campus, are wearing masks. If you have further questions on this specific mandate, we definitely would advise you to consult your legal teams or any other legal group that you have to assist you in interpreting some of that guidance as it moves forward. If there's any questions of that, please just go ahead and drop them in the chat. I do see one from Naomi McIsaac. Is it okay for remote staff to have masks off when working alone in their classrooms? Yeah, so you can see where right here in the document that there are instances where students can socially distance. Outside in playground settings, students will be allowed to take off their masks while during breaks and in safe environments. I do believe that there is a, for remote issues, that there could be an exemption on that. But Dexter, if you want to maybe dig a little bit deeper into that question, and we can get Miss Isaac an answer back by the next session. Okay, so making our way over to Pima County memorandums. And then Dex, I'm going to rely on your thumbs again here. Are you seeing the memo shared screen? Awesome. Okay. So this is where anytime the county administrator or the board of supervisors issues a memorandum of announcement or anything like that, it gets posted on this page. The link is dropped directly into the agenda where it says Pima County Admin Memos. You can click that link; it'll take you directly to this page. There's a few on here that we do want to highlight that I think are kind of important to look at. So we'll just bring those up briefly. Most of those are in November, or took place in November. So we will start off by November 23rd memo, which essentially states that as a result of significant infection rates, it's appropriate to take actions advised on the public health experts, requesting that individuals in Pima County obey a voluntary curfew, requesting no travel, transport, or activity occurring between 10 p.m. and 5 a.m. each day for a period that will continue through December 31st. So again, this is a voluntary curfew, just beginning here from 10 p.m. till 5 a.m. There are exemptions for that in terms of like hospital visits or things of that nature. Obviously, work is a piece of that. There's a lot of good information in here in terms of the overall numbers and averages we're seeing as a whole. And then it gives you some of the guidance for the voluntary curfew advisory that goes in at this point as well. So here's where you can find those details of attending essential activities, attending work, obtaining food, medical care, medicine and supplies, care for family members, or responding to urgent or emergency situations. There is a move to try and seek a mandatory curfew, which you'll see here on the 11:30 weekly COVID-19 report, which I'll jump to in a little bit. But first, I want to jump over to suspending use of activities for county facilities, for sports teams and team activities. We've been advocating for this for a while on our part, and I'm just going to be very candid with everyone on the call. I personally have felt a little frustrated that we've been asking schools to cease sports activities, but the county has still remained open for that. That's been a really big thorn in my shoe and in my back, and we finally got this pushed through. So I'm very happy about that. It just essentially states that any Pima County facilities cannot be used for any kind of sports tournaments, leagues, or team activities from this date until December 31st, 2020. And Brother Jesus, I will address that comment in a moment. So yeah, we're happy about that happening. Sorry about that, I got muted there for a second. We're going to ask, though, if you are just joining us our call, if you can please mute yourselves, that'd be helpful. Thank you. So the November 30th memo, it just says they've asked the county attorney to evaluate and determine what actions could be taken, including a little bit further down the line here. And sorry again, if you could please mute yourselves if you're joining us. I'm just hearing a little bit of background noise there. Voluntary curfew hours, implementing mandatory curfew hours, establishing civil fines for mask violations, and having civil infractions enforced much like a traffic ticket through law enforcement. So these are some of the things that we're looking to expand on in Pima County as a whole. Again, because our numbers are escalating at an alarming rate. This is the overall report for MMWR week. You can already see in week 47, the estimate of that is far above where we were in June and July. In week 48, where we're expecting to see a drop if we implement a curfew. So there's some strategies in here that support the rationale for extending some of these potential laws, shelter-in-place things of that nature. For Brother Jesus on the comments there, I don't know if the mayor's order for the city of Tucson has gone into effect. Remember that the city and the county are two municipally separate entities. So the Tucson curfew, I believe, is supposed to go at 8 p.m. I don't know if that's passed. We are going to include updates on that once we get finalization on that. I was checking the city website today to see if there were any updates on that as of yet, but it looks like as of now, there's just been a couple of press releases and news articles, things of that nature. I don't believe that the city council has actually made a vote on that curfew at this point in time. But when we learn about that, we will definitely provide an update on this session. And Penny just posted a comment saying that they were meeting today to vote on it. Okay, cool. So Dexter, can you see the agenda when I drag it over onto the screen? Or is it just staying on the Google Docs?
You're still on the memorandums and stuff. Okay,
no worries. So I'm just going to move over to some of the other metrics here. So ADHS data and stats. Okay, so for Pima County, you can see our percent positivity is currently hovering at 8.9%. We're up to 147 per 100K. This is of last Thursday, so you'll see another update on this this Thursday, where we should see some of these kind of jump up here. So we are in the red for cases per 100K. We're not in the red for percent positivity as of yet, nor are we in the red for hospital visits for COVID-like illnesses in the region. So those are some of the metrics to kind of update and discuss here. The close contacts information, I want to go over that again briefly, and I'll come back to the metrics in a second to talk about what the implications for that are. So again, close contact is 6 feet, within 6 feet for a cumulative 15 minutes or more without a mask within a 24-hour period. You've cared at home for someone with COVID-19, if you've had direct physical contact, such as hugging or kissing, you shared drinking or eating utensils, they sneezed, coughed, or somehow got respiratory droplets on you. Those are the important points here. Okay, and then what to do if you've been in close contact. So keep those things in mind. And last thing here is outbreaks on schools. And I'm actually putting together a document right now that I'll give you all a brief preview on. So let me do a stop and a re-screen share here. Okay, and Dexter, if you can give me a thumbs up again, if you can see this COVID cases document.
I currently see, I see me, actually. It's, looks like the team screen and then the agenda.
Okay, one more second here. Sorry about that. Nope, it's wrong screen. Okay, there we go. Now that should be coming up. For Brother Jesus, the close contact flyer we got from the U of A, from some folks over there that ran some, were able to put together infographical information for us. It is shared out on the agenda, so if you have a copy of the agenda, you can click the link that says close contacts. You're more than welcome to use that, and we will send out another copy of the agenda post the session today. So I'm currently putting together this report, an infographic display of COVID-19 cases for schools reporting in general. As of today, we've had a total of 924 cases reported from our schools that's back from August 1st. The number of outbreaks involving 2 students are 10. The total number of outbreaks as of today have been 21 outbreaks in schools. The total cases from outbreaks total in a number of 72. So 72 of the 924 are due to outbreaks. That's 7.79%. So of that 72 total cases and of the 21 total outbreaks, there's only 10 of those that have involved 2 students in total. This changed as of yesterday. We were at 19 as of noon at yesterday. We're up to 21 today. So we've had 2 more outbreaks reported as of yesterday at noon till this morning. What does all this mean? So essentially, what we've said as a health department is that schools and mitigation practices taking place within schools have allowed schools to remain in a hybrid instruction, and that the health department supports hybrid instructional models because of the mitigation taking place in schools, primarily because of the lack of classroom transmission, meaning that students as a whole are not as likely to actually be in classrooms. Okay, so the other, if you take 10, multiply it by 2, you've got 20. So 20 total cases have involved 2 students. That leaves the remaining 52 total cases from outbreaks being more than 2, where there's a lot of those that are related back to athletics. And that's the rest of this chart that I'm working on processing out, like how many are due to athletics versus staff lounge or staff spread. We've had 10 total cases that have been due to staff spread, meaning like there's been a lunchroom situation, there's been an out-of-school get-together for staff that we didn't classify as an outbreak, but just anecdotally we've had that happen. One school was shut down because of that. We've had on bus with or between some transportation bus staff that there was an outbreak where the transmission happened at the transportation staff lounge area because mitigation was not being followed, masks were not being worn, and folks were standing 6 feet to each other. So the overall theme and the reason why we're putting this information together for you all is to again make the point that mitigation matters, that pandemic prepared schools are a critical part of in terms of like operating safely and providing safe places for our kids. So hybrid instruction is still totally possible, and it can be delivered in a safe way for our schools in Pima County, and we support that because of the mitigation that you're putting into place. So we want to continue that message. We want to continue to see these trends. We've had one of these total cases from outbreaks. There was 24 total cases that involved a sports team. And we've had other ones where there's been 5 or more cases because of those sports teams outbreaks. So, be really on point with your mitigation, wearing masks and socially distance, and you won't have an outbreak at your school site. And that, again, the outbreak is when that transmission is happening from student to student on campus. Question from Chris at Veritas. Can you clarify what you mean about hybrid instruction? Yeah, so hybrid is any blend of remote and in-person learning. That's what we mean by hybrid. We did a previous session on different hybrid strategies. However, because we're not the educational experts, we are trying to avoid getting in too much into the weeds with that topic. But that just means that there's some students that are operating remote, some staff that are operating remote, and then some that are in person at the school site. So I hope that clarifies, Christopher. So this should be done by noon today, and then we'll be blasting this out. There will be some communications updates on this that happen before we can actually send it out. But just know that this is coming on the pipeline for you all. Okay. Moving back to our shared screen again. And pulling up the agenda. Okay. And there's a couple other comments in the chat I want to cover here briefly. From Sherry Dahl, as our school principals still recommended to ask for documentation from contact tracers regarding a student or employee who needs to be in isolation and a quarantine. My understanding is that schools would give their recommendation to family household members, but if contact tracers are all recommended, then the parents would give it. Yes. Okay. So school principals are, we don't recommend that school principals ask for that documentation from contact tracers. What we recommend is that they ask parents to receive that documentation from contact tracers or a case investigator. So that's the slight distinction on that, Sherry. And if you need to unmute after this clarification, then by all means, please do. So we definitely want the isolation and quarantine guidance to be followed, and also note that because of the volume of cases, there's a lot of close contacts that we just are not that we're not able to get to. It's just not possible at this point in time. Once we hit a volume of reportable cases of 300, and I believe it's 325 in one day, then the extra goes up to the state to conduct contact tracing case investigation. And that's been happening on a almost daily basis for us at this point in time. Again, the recommendation is to encourage family members to get that documentation when they have the discussions with contact tracers, case investigators. But otherwise, you're just going to have to take families at their word. So if a parent says, well, the contact tracer told me that my quarantine isolation ended on December 1st and that I could return on December 2nd, unless you have that documentation, you'll have to take them at the word. So you can ask for it and hopefully receive it. Most of the time, if that parent was discussing that and asked for it from a contact tracer, they should receive that documentation. And yes, Dexter, absolutely. Thank you for putting that forward, Dexter. We'll clarify that later too. Okay, so this moves us to the next point in the agenda, which is exceptional education classroom mitigation. I have asked for a couple of folks from another call to actually join in on this today. And I'm going to ask that anyone in the virtual room here that has experience around exceptional education, if you want to chime in on the chat box at any point, then I'll ask you to unmute yourself and just kind of chip into stuff as we go through everything, okay? I am going to keep the slide deck presenting as such, just because that way I can keep my eye on the comment chats and everything. It's just a little bit easier for me. So for mitigation strategies, this is again specifically for exceptional education classrooms. So those of you on the call that that deal with those situations, this training is specifically for you, and it just hopefully will give you some ideas about where to go, where to get resources, and what to do to assist with mitigation as it pertains to exceptional education classrooms. So you definitely want to emphasize mask wearing for staff and students. having instruction suitable for students with autism. There's a whole idea of social storyboarding, which if you haven't heard of that, that's a really great resource specifically for students with autism or that are on the autism spectrum. And then those social stories specifically in regards to the 3 W's in the mitigation strategies, which include that wash, wear, and wait. Which again, to repeat this for everyone on the call, wear is wearing a mask. Wait is inferring the social distancing or 6 feet apart. And then wash is the washing of hands and of frequently touched surfaces. Providing photos or picture instructions to increase student comprehension is also a helpful tool for that. Plastic face shields only for students with disabilities and mask wearing are helpful. We have some examples of that later in this PowerPoint that we can show you, which include things like the Humanity Shield and the Badger Shield. This is also important for students who are in the deaf and blind population that need to lip read or do those kinds of actions in order to facilitate comprehension. Maintaining the 6 feet physical distance can work if you set up plexiglass dividers for testing or working with students in that population, using pointers for stimulus books, and putting plastic over test kits, etc. Minimizing how many EAs, that's exceptional educational aids, are assigned to a student throughout the day to prevent excess contacts, and taking precautions to reduce transmission. Again, wearing masks, right? So wearing personal protective equipment, disposable gloves, and lab coats if you're in a situation where you're needing to, and then frequently sanitizing high-touch surfaces and shared resources as well. And we have some other information about that specific strategy a little bit later here. Reinforcing behavior in students, like creatively engineering schedules to reinforce repetition of mask wearing and hand washing. Multiple students having issues with mask compliance, then you want to stagger schedules and try to get those students cohorted together. Developing behavior plans and reward systems in supporting of mask wearing and hand washing. There's a couple of different examples of this where students were reinforced with little plastic tchotchke-esque kind of toys that the online manufacturer that does all the little plastic bouncy balls or soldiers or figures. Make sure that if you're in a situation where there's choking hazards, that those aren't the items that are purchased, but incentives are purchased that meet the standards and policies and procedures as it pertains to choking hazards for those specific student populations. But also reinforcing behaviors in staff, making sure that staff are trained in the effective use of masks and or other PPE, including the safe removal and the safe and proper way to put gloves on, to don PPE gloves, and how to remove those properly. Some of the barriers to mitigation in exceptional education, of course, there's the obvious one of difficulty maintaining physical distance with students. So there's a lot of students who need speech therapy, PT, OT activities of daily living, which require physical proximity. So again, mitigation is the key term there to remember. Donning appropriate PPE there, and if you can, try to limit that close interaction if possible. There's issues with self-managing of hygiene, which include runny noses, covering cough, various amounts of body fluids that are produced in whether that's through drool or things of that matter, keeping hands from face. There's some barriers around behavioral issues, including yelling and spitting. Students with medically fragile diagnosis require continual monitoring. Students who require transportation are important to keep in context here too. So how are you, if you have students that are wheelchair bound, how are you sanitizing those surfaces, like the handles of the wheelchair, the wheels of the chair? Are you wearing gloves and masking with fidelity in those kinds of situations? And there's also the necessity of touch for deaf and blind students. And in those kinds of situations, gloves may not be appropriate because of the lack of tactile ability within those situations. So again, that kind of goes back to how you implement mitigation, layered mitigation with these populations. If you're not able to don PPE, but looking at the socially distancing within those situations as best you can. Some of the other barriers to mitigation in exceptional education classrooms are the difficulty in maintaining physical distance to other educational aides. So large student teams providing different services from specialists can cause some serious barriers to mitigation. The staff proximity while eating lunch or working together with the same student is a really big barrier to mitigation. So thinking strategically about how you can place yourself at a low risk of intersection of respiratory droplets when you're eating lunch in those settings is an important piece, right? The resistance to mitigation techniques are also some of the other barriers that we see, which are things like students removing masks because it's quote unquote after school or it's before school, it's not during school time. Parents not wanting students to wear masks, doctors writing notes excusing symptoms without testing for COVID, and staff resistance to masks or lack of fidelity to mitigation procedures. There are a couple of things in here that I do want to address just briefly, right? One of those is that if parents don't want students to wear masks, we've seen a lot of schools put into their verbiage or their policy that if it's not safe for you to wear a mask, then it's not safe for you to be in school right now. And that kind of policy stance, has been really effective for a lot of our schools. Some of the other barriers to mitigation in exceptional education include students being sensitive to cleaning supplies or sanitizing products. So having an alternate schedule of cleaning products or having alternate products that are meet the medical needs of your students are important things to consider. The medical diagnoses from students wearing masks, and again, I talked about that a minute ago, about taking a hardline stance on a policy around that when possible. Specialists having to work with multiple students in one class. This is kind of addressed earlier in the sense that with educational aides or one specialist, there's a large amount of students that individual has to touch or interact with within those settings. Then there's a hierarchy of roles as well. There's classified staff that are at higher risk. Forgetting mask wearing or mitigating behaviors and those kinds of things needing reinforcement. But one of the other things that's a barrier is the coordinating or tracking protocols from 150 districts and charters all separately. So all of these different entities can sometimes have different tracking protocols in terms of those exceptional education students. Seeing a couple things pop up in the chat here. So I'm just going to take a moment to jump on some of these. And I see Dexter got Megan's question earlier, which is awesome. Thank you, Dexter. The same recommendation for 2-year-olds 0 to 2 that are unable to wear masks. Actually, there's some legal discrepancy here in the sense that Tucson and Pima County mask mandate is 5 and under, so you don't need to wear a mask at those ages according to that legislation. However, because of the emergency measure that we covered at the beginning of this session today, which specifically states 2 and under being exempt from mask guidance, the state supersedes anything that the county or city does. So to respond specifically to your question, Miss McIsaac, is that for the 0 to 2 age range, they are not required to wear masks. And in those situations, the mitigation really falls back on the classroom supervisors or the managers of that classroom space. So whether it's a teacher or a couple of exceptional education aides, we would recommend other PPE to be utilized, which would include things like gloves and gowns and things of that nature. And any time a bodily fluid gets onto any of that PPE, it would need to be changed out appropriately following the procedures that are that would need to be adhered to in order to keep that equipment medically sound, if that makes sense. The next question from, oh, Dexter got that one. Thanks, Dexter. And Penny, I think, yeah, you're on that one too. Oh, yeah, I see what you're saying, Emily. Yeah, we're not recommending that. Yeah, they at that age, if you're exempt, then you can be in the classroom. Current guidance for asymptomatic students, positive case, and they cannot isolate a 10-day waiting period and then a 14-day quarantine, so a total of 24 days from onset of parent symptoms or positive case diagnosis. Okay, question from Ms. Auxiliary. If there's an asymptomatic student, then we are assuming that they are a positive if they're asymptomatic, right? Which means that they have a positive test that's been taken. So just small clarifications in language, because words are kind of important. So if a student tests positive, they've got to isolate for a 10-day period. If I'm reading your question properly, though, it means that the parent was positive and the student can't isolate, then yes, there would be a total of a 24-day period in which that student would be removed from education. However, and this is a big footnote on this, if the contact tracer calls this parent in reference to the student specifically and says that the student has to quarantine for 14 days from maybe like day 5, for example, of the parent's isolation, and gives you a different date, that's where that documentation is really important for you to request from that parent, to get that documentation from the contact tracer or from the case investigator that specifically states that student X can be released from quarantine or isolation on such and such a date, okay? So that's where, our default here is whatever the contact tracer case investigator says when they have the call with the parent, that's the guidance you're going to rely on. I'm going to jump back over to the exceptional education mitigation, and we'll go back and check chat box for questions shortly after that. So there's some here that I want to review based on those barriers to the mitigation that we saw earlier. Some of those adaptations include, there's 2 larger categories. There's the actual mitigation adaptations, and then there's some mitigation awareness strategies, some of these which were referenced earlier. For the mitigation adaptations, for the washing, building in a daily deep cleaning into your schedule is really important, and working with your custodial staff to make sure that if there's chemical sensitivities, that those chemicals are not being used in those classrooms, and there's appropriate substitutions that are being utilized within those spaces. That there's systems for cleaning toys or other objects within the classrooms as well. So this isn't just like your commonly touched surfaces. This may be in reference to typing boards, or if you're with the Montessori system, there's a lot of tactile and kinesthetic learning tools that are used, making sure that there's systems for getting those cleaned on a daily basis. Really trying to adhere as best you can to no shared items. But if there are specific items like blankets, like pressure blankets or weighted blankets that need to be utilized for exceptional education populations, that maybe there's an extra amount of those items ordered, and that each item is assigned to one child, especially for occupational therapy based interventions. For the wearing of mitigation, the clear masks were referenced earlier. There's a link embedded in this to the Humanity Shield, which is one of the things that our medical director, one of our medical doctors here, Dr. Carlos Perez, has specifically cleared for usage in these populations, in these settings. And then we've mentioned a lot today the instructor use of disposable gloves and gowns, and making sure to use that appropriately. So again, after touching a student or getting any kind of bodily fluid on those gloves or on the gown, that item is changed immediately, disposed of appropriately, and then new gear is donned appropriately as well. For the weighting, The outdoor instruction is a really good option, and that could actually be helpful for a lot of students in exceptional education populations. And knowing that there's some students that won't work for is important. So know your population, know your behavioral plans. Defining your areas with shapes and or colors. So just going into this in a little bit more detail, if you've got a 6-foot radius around a space, making sure that you have clearly delineated markings on the floor using maybe hula hoops as a boundary or using coned off areas within a classroom, adding color to those boundaries, thinking about using butcher paper to help markate out on floors where boundaries might be, and then overlaying that strip of butcher paper with some clear packaging tape so that it has a little bit more longevity in its life term. There's lots of colored duct tape out there. That's a really great way to demarcate areas on the floor and to separate students and try to adhere to some kind of social distancing. And one important anecdote of this is gamifying things. So making it a game so that the students have to stay inside their zones throughout the day, and incentivizing that game. For the longer that they stay in those zones, then they get a reward for following those behavioral recommendations. And then when you demarcate or when you do those zones or boundaries, you want to develop those based on the behavioral plans that you have within your student populations. So if you have students that that have either noise or color sensitivities. So for example, there might be a student that has a trigger sensitivity with the color red. You definitely want to avoid using the color red and demarcating the boundaries within that area. Okay, these are just small examples that you can use to assist with adaptations to barriers. Jumping over the mitigation strategies around awareness, there's a social stories, which I kind of talked about earlier. There's a link embedded right here that takes you to a really great page that has really good definitions. I think it's the Parents Parents for Autistic Children Coalition or organization. It's a national organization that has a lot of really great resources, but the social stories really springs from that. You want to use these social stories for all of the adaptations mentioned on the left for the washing, wearing, and waiting, but also you can use these social stories for anxiety and for other kind of COVID mitigation. So lessening stress or for other types of behavioral interactions, you can use these social stories to encourage those kinds of behaviors for exceptional education populations. Really lean on your district resources, even if you're a charter school and you preside within like TUSD school district, for example. My understanding is that you can lean on TUSD resources and the procedures that the district has already set out in relation to COVID mitigation for exceptional education populations. So there's a lot of districts that have already done some really great work around this. So don't be afraid to tap into those resources. Storyboarding for students, which is connected to social stories, but there's some slightly different context there. There's also, outlining your class setup and doing that with maybe some designers or some what is the name of it? Feng Shui actually has some really good applications with COVID mitigation. So you can incorporate some of those strategies into this with your classroom setup. Using portable low vision aids for remote and distance learning, and distance in the terms of actually like 6 feet apart for your classroom, or if you've got students that are visually impaired, making sure that they have some portable low vision aids available to them in that setting so that you can maintain social distancing during your instructional time. Technology is really helpful. And then also utilizing telemedicine options for medical interventions for students who are medically sensitive. I'm just going to briefly cover this slide because inclusive education is one of the things that's come up a lot in our discussions with folks on these calls. So education with an inclusive lens, there's some strategies out here that it looks like there's some words that didn't quite make it in. for whatever reason, I think in the finalization of the slide, there's some things that cut out. But important things are determining the community, designing remedial courses, accessibility for catch-up classes, tutoring, and accelerated curriculum delivery. And then making sure that your disability inclusive social protection is really addressed as well when you're going through all these mitigation strategies within an inclusive learning classroom. I'm going to tie it up with just showing the resource slide here. So any one of these, there's a lot of really great resources that can assist you when you're developing your mitigation for these special populations. So again, you'll all get this PowerPoint. Everything in here is you can totally reuse. The majority of this content was developed based on a very long and helpful conversation I had with our local chapter of counselors that work together in a coalition, and school behavioral health folks. Lots of really smart folks.
They're asking if there's a document about this 10 plus 14 days.
Yeah, I just read that.
Sorry, well, if you could just mute yourself there, whoever that is. Thank you. Okay, so we're going to jump over back to the questions here in the comment box. And then Dexter, if you got the question already, just give me a thumbs up. First one from Emily Ernst Loon. All right, you got that one, thank you. Then from Megan Joyce, and yes, we will send out the PowerPoint. Question from Sister Veronica. Regarding Stephanie's question, is there a document stating the 10 plus 14 days for children with exposure to parents who are positive? I have been following the release from ICD coordinating guidance and referring parents to the document as needed. It would be helpful to show the parent a 24-day requirement in writing. I will work on getting that for you, Sister Veronica, and we can try to send that out. I know verbally we've stated that, and I think we had a document in the works, but then everything happened with the deferment to contact tracers, case investigators, as the primary mechanism for the quarantine and isolation release. So yeah, that's we'll see if we can get that up for you. And then Christopher will, yeah, just second that too. Okay. Just double check, is everyone seeing the agenda here now? Dexter, are you seeing that agenda? Okay, cool. So that wraps up everything for today. And we've got a lot of questions in here, so we'll just continue to address those at the, for this point in time. If we have a negative COVID test with some direct exposure, are they still to isolate for 10 days? Great question, Ms. Cornitas, but and you know what? I'm actually going to bring up the document release from quarantine and isolation, because this is really going to be helpful.
Pop the link in the chat there, Brian.
Awesome, thank you, sir. Okay, so I actually had quite a few questions about this in the last couple of days. So I wanna point something out on this. There's a lot of folks that have been really concerned about this. Asymptomatic and awaiting, no isolation is required. But check this. So there's a double asterisk here, right? If you scroll down on this document to the double asterisk, this is the part where there's a lot of the questions that I'm getting are very specifically answered here. A person who has had known close contact with a confirmed COVID-19 case should quarantine for 14 days from their last exposure to the case, regardless of negative test results or illness where no testing was performed. So there you go. There it is. If you've been exposed, you should quarantine for 14 days. There is no testing out of quarantine. We may see the quarantine amount, the days of quarantine actually change at some point here soon. I don't have a date projected for you on that. I don't even know if it actually will happen. We are recommending that happen in our conversations with the CDC and with the state. So you know, we'll see if we'll see how that happens. For Aaron, how is this guidance about quarantine and isolation shared within the medical community? Aaron, this is one of the banes of my existence right now. We have been reaching out to urgent care clinics, to medical clinics. Anytime we get a call from a school professional who tells this doctor told us this guidance and it's not accurate, it's not in line with what the county is saying, the more specific you can be about who that doctor is or where that guidance is coming from, we follow up with them directly. There are definitely I would say over 500 plus medical providers in Tucson, easily over 5,000, right? Of the primary healthcare providers, there's probably about that many too. We have no way to ensure that each and every one of those medical providers is reading the documentation that the county health department is sending out to them on a consistent basis through our ambulatory care unit that states the quarantine and isolation guidance. I think it's hard enough to just get everyone on the same page with this, and we are trying our darndest to make it happen. So if you have any specific instances of doctors or urgent care, whether it's Next Care or Southern Arizona Urgent Care, and there's a few of these that you've probably heard of because I've heard the names a lot, then send them over to us and we will reach out to those organizations and, try to do what we can. Diana Miranda, put a link in there. Dexter, if maybe you want to open that up and just kind of reference what that's about there. Thank you for dropping that in. If the teacher was wearing a mask, does this mitigate it? That's a great question, Mr. Speta. And we want to, we've seen evidence that wearing masks with fidelity decreases risk of transmission even in close contact. But we have to align with state and CDC guidance because what does mask fidelity actually look like? And having a common definition across the board is very challenging. Someone could say that they were wearing a mask with fidelity and then, their nose is exposed, so on and so forth. So at this point in time, it does not mitigate the quarantine or does not cancel out the quarantine or isolation guidance if it's a close contact. What are the requirements for public notification if a student tests positive? The only requirement for public notification is that you notify the health department that there's been a positive test. Dexter actually previously showed the legality of that and what that means on a previous webinar. The public notification, though, means if you've got 2 or more cases that are epidemiologically linked, essentially an outbreak, which I showed earlier the county's tracking of outbreaks currently, which there's 21 up to date from today, then in those cases, you absolutely need to notify every parent, guardian, staff, faculty, and the school that there has been an outbreak at the school. And I'm waiting actually for a template from ADHS on an outbreak letter that gets mailed out to folks when that situation is met. We're required to notify the health department when a student is learning remotely. We definitely want to know about every single student, faculty, or staff that tests positive, even if they are remote. The reason for that is because and this has happened already a couple of times, where a student is a remote learner, they went and they took a positive test, they didn't report it to the school. The contact tracers or the case investigators, because again of the backlog of cases, never were able to get to that individual in time. So there's a break in communication there. By going through our team, by going through the school reporting team, the chances that the individual will be contacted by a case investigator drastically increase. I don't have the actual numbers in front of me right now, so I can't give you the specific stats, but the vast majority of the folks that report through the health department when it comes to schools cases are contacted in a timely manner. especially if it's a positive case. And that's because we have a specific team of folks from Maximus, which is the contact tracing case investigation subcontractor with the county, that actually are assigned to schools' cases only. And that's only their job, is to work on that. Question from Watsco Cawthorn. I'm going to have Dexter, if you can actually pull up that memo on the reporting of every single positive case for Lisa there, and just drop it either into the chat. That'd be great. It does not apply to parents. Parents do not count because they are not faculty, staff, or students. Okay, so that the positive test doesn't apply to that situation. I hope that clarifies, Christopher. And please submit positive cases even if they're on break and if they've tested positive prior to returning to school, so that we can touch base with folks. Because if we don't know about it, we can't touch base with them. So any student that's associated with your school, report the case. Remote, not remote, on vacation, doesn't matter. Report the case. Any staff, any faculty, vacation, remote, out of school for 10 days, whatever it is, report the case. We want to know about it. If it's a case from August, we don't want to know about it. Don't worry about it. That moves us through the entirety of the agenda today. We've gone through some other extra materials. Again, we did post the link, Dexter posted that earlier, to the quarantine isolation guidance document. I will look for the memo and send it out as an addendum to an email on everyone that was on this call today. But that concludes the call for today. I appreciate your time and effort. I'll stay on for a couple more minutes to